Now let's take a look at the risk factors for cancer. The incidence of cancer rises dramatically with age. This is most likely due to an accumulation of exposures to risk factors over time. Genetic predisposition also contributes to cancer risk. Inherited genetic mutations play a major role in about 5 to 10% of all cancers. Tobacco smoking is a risk factor for cancer. We usually associate smoking with lung cancer, but actually smoking can cause cancer almost anywhere in the body, including in the larynx, mouth, esophagus, throat, bladder, kidney, liver, stomach, and these are just to name a few. Some infections have also been associated with cancer. HPV can cause cervical cancer. Hepatitis B and C can cause liver cancer. Epstein-Barr virus or EBV can cause lymphoma or nasopharyngeal cancer, and Helicobacter pylori can cause gastric cancer. Exposure to radiation can also increase the risk of cancer. Exposure to UV radiation can increase the risk of non-melanoma skin cancers, and exposure to ionizing radiation can increase the risk of leukemia, thyroid cancer, as well as breast cancer. Immunosuppressive medications can also increase the risk of cancer. Many people who receive organ transplants take immunosuppressive medications to prevent organ rejection. However, this can reduce the ability of the immune system to detect and destroy cancer cells or fight off infections that cause cancer. The signs and symptoms of cancer depends very much on the location, size, and invasiveness of the cancer. Some common signs and symptoms in general for cancer are unexplained bleeding, unexplained weight loss, a lump or swelling somewhere, and unexplained pain. These signs and symptoms can be caused by many other diseases, so they are not very specific for cancer. Screening tests are conducted for people who may be at risk for certain cancers but have no signs or symptoms. Screening is important because it can help to detect a cancer in its early stages. This is when there is a better chance of cure. Some examples of screening tests are pap smears to detect cervical cancer, mammograms to detect breast cancer, blood tests for tumor markers, which can detect a wide range of cancers depending on what tumor markers are tested for, and fecal occult blood test is used to detect colorectal cancer. If cancer is suspected, diagnostic tests would be performed. Diagnostic tests can include blood tests to detect tumor markers. Diagnostic imaging is also commonly used, for example, X-rays, CT scans, MRI, or ultrasound to look for tumors. But biopsy is the most reliable confirmatory test where tissue from the tumor is actually taken out and examined. When someone is diagnosed with cancer, grading and staging will be done. What's the difference between a cancer stage and cancer grade? Tumor grade is based on the appearance of the tumor cells under a microscope. If the tumor cells look well differentiated, then they will be assigned a lower grade. Whereas if the cells look undifferentiated, they will be assigned a higher grade. Generally, lower grade cancers indicates a better prognosis. Higher grade cancers tend to grow and spread more quickly, and therefore they may require immediate or more aggressive treatment. On the other hand, cancer stage refers to the extent of the cancer. There are several staging methods that can be used, and the TNM staging is one that is quite commonly used. So in the TNM staging, a score is assigned according to T, which stands for tumor. How big is that primary tumor? N stands for nodes. Has the cancer reached the surrounding lymph nodes? M is metastasis. So has the cancer already spread to distant sites in the body? Once T, N, and M are determined, then the stage of 0 to 4 will be assigned. So, if a cancer is said to be stage 0, that means abnormal cells are present, but these abnormals have not yet spread to the nearby tissue. Stage 0 cancer is also called carcinoma in situ or CIS. CIS is not considered cancer yet, but it may become cancerous. Stage 1, Stage 2, and Stage 3 means that cancer is present. The higher the number, the larger the cancer tumor, and the more it has spread to the nearby tissues. Stage 4 means that the cancer has already metastasized to distant parts of the body. The main treatments for cancer are surgery to remove the tumor, radiation therapy to burn away the tumor, and this is usually used in conjunction with surgery and chemotherapy, and chemotherapy to kill cancer cells. This trio has also been called slash, burn, and poison. Hormone therapy can also be used for some cancers that are sensitive to hormones. For example, some breast cancers are sensitive to estrogen, and prostate cancer is sensitive to androgens. Hormone therapy works by depriving the cancer cells of these hormones that they need to grow. Immunotherapy is a newer form of treatment that uses certain parts of a person's immune system to fight cancer. There are many forms of immunotherapy, such as monoclonal antibodies, CAR T-cell therapy, immune checkpoint inhibitors, and cancer vaccines. If the cancer has progressed beyond the hope of a cure, palliative care has an important role to relieve the symptoms that are caused by cancer and improve the quality of life of patients and their families. Palliative care encompasses physical, psychosocial, and spiritual care. There are some things that we can do to reduce the risk of cancer. Quit or avoid tobacco use. Maintain a healthy weight and be physically active. Eat a healthy diet containing fruits and vegetables. Limit alcohol consumption. Protect your skin from UV rays. Get immunized against certain viruses or infections that can cause cancer. And do screening to detect any cancers at an early stage. In this lecture, we have looked at what are benign tumors versus malignant tumors, how tumors are named, the 10 hallmarks of cancer, risk factors for cancer, signs and symptoms of cancer, screening and diagnostic tests, grading and staging, and finally, the treatment and prevention steps for cancer.